July is considered Fibroid Awareness Month, and the goal here is to educate people about uterine fibroids, their symptoms, and the available treatment that's out there. Right now, the uterine health legislative package is gaining steam up on Capitol Hill, but there's much more work ahead to get the measure across the finish line. Here's Karen Kafa.
Janelle Henry was diagnosed with fibroids a few weeks before her 40th birthday. She didn't know what they were and says it was a confusing time.
What I did realize was that it could affect my fertility and it could affect just my quality of life. And so I started studying about fibroids.
Uterine fibroids are the most common non-cancerous tumor or growths in women of childbearing age. According to the Mayo Clinic, Black women in the U.S. are up to 3 times more likely than white women to develop uterine fibroids. Henry learned about the different treatment options, including a hysterectomy, where doctors remove the uterus and sometimes other reproductive organs.
I wanted to preserve my fertility options, and so I decided to have a myomectomy 2 years after that diagnosis. And that was a long healing process, but I had a fantastic team.
Henry is the director of programs for the White Dress Project. It's a nonprofit created to support women with fibroids.
We are going to be empowered by this color, and we're going to take back control of our bodies and really advocate for the things that we need to do to have the quality of life that we deserve.
This month, the White Dress Project joined several other advocacy groups in Washington, D.C. for a roundtable hosted by New York Representative Yvette D. Clarke and some of her congressional colleagues. Clarke is sponsoring a uterine health legislative package and is hoping to get more support across the aisle.
This is a nonpartisan issue because it affects women across the spectrum. Black women have a higher prevalence, but it doesn't mean that we're the only women that are experiencing this.
Clarke and one of the bill's co-sponsors, Representative Chantel Brown of Ohio, both struggled with fibroids for years.
Too many women have dealt with this in silos and in silence. And we want to break the silos and the silence and the stigma around this issue.
Clarke's legislative package is comprised of 4 bills, including the Stephanie Tubbs Jones Uterine Fibroids Research and Education Act. It honors the late Congresswoman who first introduced the bill in 2001 and calls for more research funding, along with increasing education and training for medical professionals.
We need a generation of OBGYNs that understand exactly what this means to women's bodies.
There's also the You Fight Act, the Uterine Cancer Study Act, and the Uterine Fibroids Awareness Month resolution. In addition to lawmakers and advocacy groups, Oscar Award-winning actress Lupita Nyong'o is sharing her personal journey to help raise awareness.
I think that we are making tremendous progress, normalizing the conversation. This is something that happens way too often, and it deserves to get some greater understanding around the cause, the cure, and more treatment options.
In Washington, I'm Karen Kafa.
By the way, uterine fibroids impacts an estimated 26 million people, women here in the U.S., and according to National Institutes of Health, more than 15 million of them will experience associated symptoms or health concerns.